I'm Stephanie Shelton, and this is episode 35 of Conversations on Health, How We Get There. And I'm recording from Prague in the Czech Republic. The United Kingdom's National Health Service was founded in 1948, and it's considered the mother of all government-run health services, with Sweden's slightly later plan for universal coverage coming just behind. We've profiled both systems on this podcast series, as you know. But we're going back to take another look now at the NHS, almost exactly 1 year after Labour won a huge parliamentary victory. The new Prime Minister, Sir Keir Starmer, and his new Secretary for Health and Social Care, Wes Streeting, declared that the NHS was broken and they were going to fix it. All health systems are having trouble adjusting to rising costs and demographic changes, but perhaps the faltering NHS has gotten the most notoriety. Healthcare waiting lists as long as 2 years, doctor shortages and strikes, no hospital beds for emergency patients. It's a very long list. Under the government's recent spending review, somewhat like the annual U.S. budget outline, the NHS got the lion's share of the money, along with the military, and a 10-year plan is due shortly. But what about immediate help for the people? And have there been any improvements in this first year? So, for the answers, I went back to the UK's David Hunter, who explained how the system works in episode 11. He's Emeritus Professor of Health Policy and Management at the Population Health Sciences Institute, Newcastle University, and also Emeritus Professor at Durham University. His long list of endeavors includes the recent addition of board member at Ways to Wellness, which tries to reduce health inequalities. Now, as you watch or listen, you'll notice a lot of similarities to the US right now. Think Elon Musk's Doge and his abrupt firing of so many health policy-related government workers. And of course, our unending debate about taxation. David, thank you so much for coming back on the podcast. You are the NHS expert.
What a cross to bear.
Yes, I guess it is. So, okay, we are essentially, as we record this, almost exactly a year from the time Labour won the parliamentary election, and Sir Keir Starmer and his health minister and everybody else said the National Health Service is broken and we are going to fix it. So how have they done?
Well, it's a mixed picture, I think. I think it began well. I'm not sure Wes Streeting was right in saying the NHS is broken. It certainly was on its knees after 14 years of austerity, when the last few governments withdrew funding, didn't recruit staff, didn't retain staff, and it neglected the NHS. So 14 years is a bit of a dreadful legacy to recover from quickly. However, when the government came in last July, they very quickly set up an independent review of the NHS, led by a respected clinician, Lord Darzi, who himself had been a former minister under the previous Labour government. And he produced a lengthy 159-page report, which was well received by the health community, and he made it clear that the NHS was fixable and that no one wanted to depart from its founding principles and values, and there was no need to undergo major reform. But he set out what he said the government should take heed of in its forthcoming 10-year plan, which is due out in the next week or two. And they've been working on that more or less since they got into office last year, once Darzi had set out what he thought should go in that plan. And he talked about the need to move away from a focus on hospitals, more neighbourhood care, more community care, more GP involvement, more joining up with local neighbourhood teams. He talked about the need to shift to prevention, improve productivity in hospitals, bring in AI, bring in digital initiatives and so on. And he was very firm on one point, which is we don't want any more top-down reorganisation. So the government seemed to accept what Darcy was saying, and they've been busy working on this 10-year plan. And then a couple of months ago, in the midst of all this hiatus around people waiting for the plan and the spending review, which did favour the NHS well a few weeks ago, the NHS is the big beneficiary. Still not enough funding, still not replacing the 4% annual increase which the NHS needs and had under the last Labour government, where it performed really well. But it's an improvement. And they also stopped the strikes. Under the last government, we had over a year of strikes by junior doctors, and
Right.
that was very quickly tackled by the new government. So that was a plus. But then, let's say a couple of months ago, we then got into this huge restructuring game where the government announced suddenly, out of the blue, we're going to abolish NHS England, which is the organisation that oversees the NHS in England. And we're going to take functions back into the Department of Health and Social Care.
Can I just stop you for 1 second, just to
Do.
review for people who don't remember
Yes,
or whatever? You think about the NHS in the UK is all one
absolutely.
system, but it really isn't. It's like,
It's
uh,
devolved.
yeah. And
Yeah.
if you could just explain that really briefly.
Yes, there are separate, although the NHS in the UK is funded through central taxation, it's organised in the four countries that make up the UK. Wales, Scotland, Northern Ireland, and England all have their own organisational arrangements under the devolution settlement from '99. And there are problems in all the countries, but arguably the, England has an obsession with restructuring, whereas in Wales and Scotland and Northern Ireland, the structures are more stable. And the policies are slightly different as well, in the sense that in Scotland, social care is free, and there is more of an emphasis on prevention. But the main thing is that in England, we've been restructuring the NHS since it began, and that's been an obsession for all governments. Now, this government came in saying, we're not going to do that. We're going to focus on funding. We're going to focus on staffing. We're going to focus on making the current system work. However, as I say, 2 months ago, the government said we're going to not only get rid of NHS England, and that'll save money and lose staff, but we're going to insist that the local integrated care boards, the local bodies that run the NHS in the regions and localities, we're going to insist that they reduce their funding by 50%. Now, that's a huge
Yeah.
cut, and that's to be done by Christmas this year, Christmas. And to do that means losing staff, and not only losing staff, but talking about merging, talking about bringing some of these 42 bodies together into bigger units, and they're now talking about something like 27 will now run the NHS in England. Now, this is a hugely dislocating exercise, which is contributing to lower staff morale. Staff morale was already pretty low post-pandemic. It's lower now because people are worrying about their jobs, and thousands of jobs.
Sounds almost like what's been happening here in the United States.
Right.
There's this
Yeah.
obsession that if you cut agencies and cut people,
Yep,
somehow you're going to save all this money and everything's going to be so much better.
that's right.
And you cut expertise because
Absolutely.
most
And
people who cut don't know what they're doing.
No, absolutely. And the new arrangements are based on people working collaboratively in partnerships. And if you start losing some of that expertise and some of that knowledge, you're going to lose that focus on collaboration. People are going to be looking after their own interests. And it's going to be very dislocating. It's already been dislocating. So in the midst of all this, and as I say, these changes were not planned, really. I mean, West Streeting initially said, we're going to restructure the centre a little bit to make less overlap between the Department of Health and NHS England. At the moment, there's too much overlap between them, one looking over their shoulder at the other. But we're not going to get rid of NHS England. And then, it's announced we're getting rid of NHS England. And Keir Starmer, the Prime Minister, made a big announcement saying we're getting rid of the biggest quango in the world, quasi-autonomous non-governmental organisation, for people who don't know what quango means. But the fact is, in announcing that, and it was announced in the press, people weren't prepared for this. The staff affected didn't know what was going to happen. And they read it on the news first.
Oh, wow.
So the way it was handled was appalling. And I mean, it was completely insensitive to people's jobs that were going to be lost. So we've got this fallout now, which will probably go on for the next year or two, because people will probably rush to industrial tribunals, saying the unfair dismissal is the issue. And this will go on. As you say, it won't save money, it'll probably cost money. And in the midst of all this, we've got this 10-year plan coming in the next week or two. I don't see people being in a position to focus on that plan, to be honest, when they're worrying about their own futures and their own careers.
What about Labour's new promise, or Keir Starmer's new promise, to push more money into areas with the greatest needs? I mean, that
Yes,
sounded like a good idea to me. And
absolutely. And he quoted Michael Marmot's work on the social determinants of health and the widening inequalities. The fact that Michael Marmot, in his update report that came out in 2020, talked about life expectancy having stalled and gone into reverse. And in
yeah,
some parts of the country, people are really getting terrible care and suffering terrible health. Obesity among children in 11 of the poorest areas in England is at an all-time high. Those kids are going to get all kinds of illnesses and disease later on in life that are going to put more pressure on the NHS. So tackling inequalities and tackling the what's being called the inverse care law, where people in the poorer areas get less appropriate treatment or none at all because there aren't the services there. People don't want to go and work in these areas. It is a challenge that the governments have ignored and neglected. So Starmer's promised to do something about that and tackle health as a holistic entity, not just hospitals and beds, but talking about health of the population is absolutely right. But I kind of feel this has got lost in this obsession with cutting waiting lists now. So we're back to the old agenda of we've got to bring waiting lists down, and we've got to tackle the fact that there aren't enough staff in position. These are important issues, but they're not the only ones that are important. But
well, the waiting list seems to be, I mean, that's what comes across to us across the pond, as it were.
yeah,
That we constantly, and that gets quoted back every time anyone talks about state-run healthcare systems. Well, look at the waiting list. You can't even get an appointment with your GP. You can't get surgery. Why would you want this? So that's why there's an obsession with it, I would assume. And as long as we're talking about it, at least from my reading, it seems like there's been a small reduction in general in waiting lists, but nothing that, the average person would even notice.
no, no. There has been a slight, but it is marginal. But Lord Darcy said in his report, this is going to take years to sort out. He said this will not be within the term of one parliament. He said we're recovering from 14 years of damage to the NHS, and that can't be done overnight. And he's right. Even if new money went in at the level it used to be under the last Labour government, 4% annually, you'd still have to find the staff. You'd still have to recruit the staff to use that money well. And we've neglected that. We've neglected recruitment and we've neglected retention of staff who are now feeling very miserable and very concerned about their own futures. And many of them are leaving to go and work elsewhere, or if not, do something else.
So in terms of one of the great problems when Labor won the election, which was a shortage of doctors,
Yeah.
and then the junior doctors feeling they weren't treating properly. I was reading some posts on X, actually, the old
Mhm.
Twitter, where doctors were saying, "Well, here we are. We're not junior doctors anymore. We're ready for posts. We can't find jobs. How could that be possible?"
Yes, there have been problems in recruitment. It's taken a long time. People apply for a post and they take months to hear whether they've got an interview even. So the whole appointments procedure has been a problem, and Wedge Streeting said he's committed to tackling that. Quite why there's been that blockage, I don't know, but it seems bizarre when, people are chasing jobs and we need those people, and yet for some reason they can't get through the recruitment process. Seems bizarre. But anyway, apparently that's in hand and Wedge Streeting's aware of the
Yeah.
problem. But there's also more problem down the road because the doctors are saying they want more pay. They're saying they'll go on strike next year if they don't get a pay settlement that begins to recover what they've lost since 2008. They feel they've gone backwards in terms of pay. And although there was a settlement when the new government came in, that was only temporary. The profession is saying we've fallen far behind and we want governments to put us back to where we were in 2008. I don't see that being possible under the current spending constraints.
I look at all of this, and the spending review that came out
Yes,
weeks ago,
yes.
which is kind of like our budget in the U.S. that the Congress has to pass. which is basically just something to drape everything on, and then you go into the nitty-gritty. But it seems to me, especially now with this new proviso from NATO, that every country has to spend, or at least plan to spend, up to 5% of their gross national product on munitions, on military. And UK is no longer a member of the EU, so it's got other expenses. And yes, it doesn't have to send money to the EU, but it also doesn't get money in other areas.
No.
So, it's really simple. Without raising taxes, which would be anathema for a Labour government, I presume, where does the money come from for the NHS?
Well, this is one of the big unknowns that the government isn't really addressing fairly and honestly. It's not leveling with people. I mean, people can't have Scandinavian-style services on the tax system we have at the present. Something's going to have to give. I mean, we could restructure the tax system. The tax system is so terms of property values and so on having changed since the last tax review, God knows when. There is a huge need, I think, to tackle our tax system. We tackle income, we don't tackle wealth. Yeah. Wealth is the big issue in our country. People have massive amounts of wealth that's not being taxed. Now, you could say, why don't we bring in a wealth tax? Why don't we restructure the tax system so that those who can afford to give a bit more do, but we don't penalise those at the bottom end of the system? And what we've been doing is the opposite. We've been penalising people at the bottom end of the system. The welfare reforms that are now being reversed or delayed is a classic example. We're saying to the people, you've got to pay a bit more and lose some of your income because the government's struggling. But the people at the top, who are doing very well in terms of wealth accumulation, are getting off scot-free. So we have a very unfair, not particularly progressive tax system at the moment that needs addressing, and the government don't seem to be even thinking about that. The other option would be just to borrow more money, just to say to the markets, we're going to improve growth, we're going to improve productivity, we're going to get people back into work, we're going to improve the NHS to such an extent that people will be able to be back in work quickly. That's going to improve the economy and productivity and so on. So we'll borrow more. But the government's very reluctant to do that because it feels it'll spook the markets in the way that Liz Truss did when she was Prime Minister briefly, and the markets, the whole government collapsed. So they're very nervous about going down that road of borrowing more.
And you'll be where we are with this huge ballooning debt that we don't know how to fix.
Absolutely. So
because we also won't tax the rich.
No, exactly. And, there are many in the Labour government, in the Labour Party and the government who feel that the government's not acting as a Labour government. It's acting too much like the last lot.
Yeah.
A bit nicer and a bit better and doing things at the edges, but not really tackling the fundamental problems and inequalities that exist. And the other thing with the NHS is, unless we tackle social care, the NHS is always going to be in a fix because people are blocking beds. I mean, people who don't need to be in hospital can't get out.
That's what I was going to ask next in line, which is, with all this talk about restructuring and everything else, it does seem like I haven't seen a word about social care.
No, there's an inquiry. The government have kicked it down the road, as governments successively do. And there's a commission that's just getting underway, but it won't report till 2028, which, is coming to the end of the parliamentary term for the government. So no change will happen in this parliament. There's no need for another commission. We actually know what needs to be done. There have been several reviews in the past, all of which remain valid, but the issues that they're suggesting need to happen are distasteful for a government because it involves tax increases. It involves finding the money by taxing people in a way that will allow social care to be provided properly. At the moment, local government's on its knees financially. Many local authorities are going bust. Local government's responsible for social care. It's a private system mainly. They farm it out to companies and so on. Most of those companies are funded by hedge funds that come in and destroy those companies in essence, pay the staff virtually nothing, poor quality staff, very little training. Staffing is more difficult now because of the problems with immigration and trying to control that. So the whole sector's on its knees. But unless we tackle social care, simply putting more money into the NHS isn't going to be the answer. It's not going to work.
So just explain briefly, when we talk about social care, in our country, we'd probably be talking about nursing homes and rehabilitation places and that kind of thing. Is that what we're talking about?
Yeah. Residential care, we call it, residential care and nursing home care. And if you're below a certain income, you can get it through the local authority. The local authority has to fund it, but otherwise you've got to lose your home or pay for it out of your private earnings. But the quality of care is very poor because it's not being properly staffed. Not, as I say, the staff aren't properly trained. Most of them come from other countries, but that's a problem now with immigration concerns. It's not an attractive job for people to go into. You're better going to work in Amazon than working in the residential care centre in terms of getting a decent salary, wage. So the whole thing is a mess. But we've known that for years. We just haven't tackled it. And this government has just put it into the long grass by saying we'll have a commission and a review. But we don't need that. We don't need one that's going to last for another 2 or 3 years either. I mean, that's just daft. So everyone's saying this 10-year plan for the health service isn't going to be worth the paper it's written on if it doesn't tackle social care. But it won't because the commission's not going to report till 2028.
It doesn't make sense. I mean,
No,
I think anybody with a basic seventh grade education can figure out that when we talk about healthcare, it's all of a piece. It can't.
absolutely. And I
So,
mean, there are proposals to have a national care system that would come either within the NHS or the NHS would move into the care system in local government,
right,
but it would be
right.
integrated. It would be a whole system.
So at this point, even if they increase the number of hospital beds so the emergency room waiting times won't be
Yeah,
so long, those beds will get filled with sick people who have nowhere to go.
that's the risk. That's the risk. And productivity will suffer then.
And in the UK, do you have an unusually large number of older people who live alone, or is it just that they need additional help, or what?
Yeah, an aging population, many of them are alone or get to a stage where they can't be on their own and they don't have family nearby or around them who can help. So they end up in having to go into social care of some kind. Or if they're ill and go into hospital, then it's difficult to get them out if there isn't a place available in the community.
Right. All right. So let's just tie this all up.
Hmm.
Um, I think most people who voted for Labour, if they cared about the NHS when they voted, hope that a year out they would see enough changes that they would feel better about the system, better about their own chances of their own health, getting dealt with.
Yes.
Is that a yes or a no if you were taking a poll?
I think people have to be reasonable. I think people are perhaps being unduly impatient. I can understand that, but I think they have to realize that after 14 years of dismantling the NHS, you can't put that to rights overnight. It's going to take time. I'm not sure the government have been good at communicating the challenges to people. I think they've given the impression when they were elected that this will all be easy to resolve and to vote for us and it'll all be fine. And I don't think they've treated the electorate as adults. I think they've infantilized the debate by not being honest with people about what the challenges mean and what needs to happen. And until we have that honest conversation, I think people will continue to think, oh, it ought to be easy to get this sorted. This government's not doing it. We'll go and get another lot in who will do something about these problems. They won't. I mean, if the alternatives, either the Conservatives, which are in a mess, or Reform, which is on the up, but they don't have any policies really to speak of. The government really, I think, have to grip this and be honest with people and say we are tackling this, but it's going to take time. But also, we need to have a conversation about where we're going to get the money from, because ultimately the NHS needs at least 3 to 4% per annum. And although it's done well in the spending review, that's only for this coming year. We don't know what's going to happen in subsequent years. So we need to have a proper, mature debate and discussion, and the government needs to be honest with people that yes, improvements will come, but it will take a bit of time.
I did see at the beginning of the Labour government that they were making contracts with the private sector to try
Yeah,
to reduce the waiting list.
yeah,
That costs money too, though.
yeah.
So
Well, the
I mean,
last
is
Labour
that
government.
likely to continue, or
Yes,
is it just
definitely.
an
No,
emergency?
that will continue and it will probably grow, probably grow. I mean, West Streeting has said we will use the independent sector to fill gaps in the NHS, but it will be a temporary measure, he says. In time, the NHS will gradually be back to full force and will run all services. I'm not sure that's going to be the case. I think once you get into bed with the private sector stays in bed,
Yeah.
and the bed gets bigger for the private sector. And people who are working in the private sector are trained to work in the NHS. So in a sense, it's a false dichotomy, really. I mean, the danger is that if you bring in the private sector to the degree the government's talking about doing, and it did this in the last Labour government in 2000s, you'll have the private sector there for good, and it will always be a kind of not a parasite exactly, but it will always be a problem for the NHS to cope with that, I think.
I think that also increases the disparity between those who have and those who have not, because those who have not probably are never going to have access to the private sector, no matter how you set it up, especially in rural areas
Absolutely.
where the problems are greatest.
And you don't have that range of services there. No, absolutely. The private
Yeah.
sector doesn't exist beyond the big cities, conurbations.
All right. So, is there anything you would add to this 1 year review?
Um, I don't think we need this health plan. I think the health plan is a bit of a distraction. I think we know what we need to do. I think Darcy set it out. We have a plan from 2019, which needs a bit of updating, but we know what the challenges are. We know what the issues are. And you just need to get on and do them. My worry is that this distraction caused by this major restructuring is going to set the health service back. It's not going to make it more easy to solve these problems. It's going to make it more difficult because of the dislocation that's occurring and will continue for the next year or two at least. So I don't know why governments have this fixation that if we just get the structure right, everything will be okay. It never is. It never is. And these restructurings absorb all the bandwidth and the energy and the attention. So the health plan is going to come along in the middle of all of this. And as I say, I don't think it will get the attention it should, or the government hopes it will. I think people are going to be too concerned about the immediate pressures on them in terms of their jobs and the waiting lists and so on. So unless the government focuses relentlessly on tackling the problems that exist and has solutions to do that, all this other talk about 10-year plans and so on is just a distraction.
All
So,
right.
I'm a bit depressed. I mean,
Yeah.
we talked more from a Labour government. We knew it would be tough because of the legacy, but we thought they might get a better grip on things and not get distracted and go into all sorts of areas that just seem to be irrelevant. And that they would tackle
Well,
the two things, the two elephants, social care being one, and getting a better grip on prevention, getting people to avoid going to hospital in the first place by talking about tackling health promotion, prevention in the community, tackling inequalities. These are the big things that need to be done.
that's so obvious.
Mm.
And every time we talk about it over here too, I never understand why they just isn't at the upper levels of government an understanding of that. I think you could cut healthcare spending in half.
Absolutely, absolutely. I mean, we already have good examples of social prescribing where people are being prescribed exercise regimes, ways of adapting their diet and so on that are much more successful and work and are sustainable and cheaper and take pressure off the NHS. But we just don't do it at scale. And governments too much focus on individual lifestyle change. They don't tackle the food companies and the food and drink industries who are pushing out all this junk food to children. I mean, the reason obesity levels are so high in poor areas is because junk food is cheap to get.
Yeah.
It's not healthy. It's highly unhealthy. Ultra processed foods are not good. But the government won't tackle this. It says, oh, we'll abolish junk food advertising after 9 p.m. Well, most kids now don't watch TV. So, I mean, that's a bit silly, abolishing advertising and TV when people are, getting their information from other sources. So the whole
Exactly.
thing is just not. There was a good WHO report that came out late last year called on the commercial determinants of health, and that sets out what government should be doing. But we're not doing it. A Labour government could be doing it, but it's not.
Well, on that unhappy note, we will end this review and we'll see what happens at the end of, say, 5 years, if they
Hope for
last
better
that
days.
long. Governments these days, at least your government changed so rapidly the last time around.
Absolutely,
Who knows?
absolutely. Yeah.
David, thank you for coming back and doing this review.
Thank you, Stephanie, for the opportunity. Thank you. Bye now.
Bye-bye. David Hunter is Emeritus Professor of Health Policy and Management at the Population Health Sciences Institute, Newcastle University, and also Emeritus Professor at Durham University. His long list of endeavors includes the recent edition of board member at Ways to Wellness, which tries to reduce health inequalities by developing new programs and delivering new services. As I record this, the August episode is still unknown, so check the show notes on my website, which I'll update as soon as possible. The episode 36, will still drop on the third Tuesday of August, since I schedule that one episode a month for this podcast. And as always, please subscribe and share. The video version is on YouTube, audio on Apple, and all the other major platforms, including my host platform, the Podbean website and app. Show notes and links on my website, stephanieshelton.com/conversations. I'm Stephanie Shelton. Until we meet again, take care of yourself and all those you love, and I'll see you around. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.